everyone, this is a very serious video about pain management. I don't know how many of you all are dealing with chronic pain, but I do. And right now I'm on my way to my doctor's for them to draw blood. I found out my doctor is moving his practice, so I went like right next door to where I work. There's a doctor there, and I went in and I said I need, to transfer all of my medical records. So she hands me these 3 documents. I fill them all out, and as I'm filling them out, she goes, I said, well, my last doctor did give me refills for everything except my tramadol. So after I filled out all these papers, then she says, well, this doctor doesn't give any type of pain management. She goes, what do you need it for? Okay, now that is the key question, because why would she even ask that if the doctor doesn't give any pain meds out? So I said, yeah, I had a spinal fusion and a right hip replacement, and the only way I can work and have any sense of any good part of my life, any kind of life, I have to be on something to ease the pain, or I would be in the bedridden, right? It's all about your quality of life. My life would not have any quality if I didn't have something to take the edge off. Now, this is what I believe. If you are really in chronic pain and you do have medical issues to back this up, why can't we get something to help us? All these drug addicts, and I know what you're saying, well, that's how they all started out. Well, let me tell you what, most of that is bull crap, because I've had many operations, and I was able to cease the pain meds without any issue. And I do know that some of you have, addiction, you have an addictive personality, but there's some of us who don't. There's some of us, like, I just quit smoking cold turkey because I started smoking when my sister passed. Some of us are able to handle it. And the ones with really chronic pain, we don't get high. We do not get high. We just get a little bit of our life back. So I don't know how many of you are dealing with this, but it is a goddamn shame that, she goes, no, this doctor doesn't give any kind of pain meds. And I go, well, what does she do for people like me? Oh, they'll send you to pain management. Well, pain management is another word for physical therapy, okay? I already been there, done that. Physical therapy did not help me at all. And in some instances, I think it hurts you, So, and I know this video will probably not be monetized on YouTube, but I don't care. All of us who are, especially baby boomers, who are dealing with all of our pain because we overdid it, by sports, or we were in car accidents, or whatever the case, or just because of old age. We should not be penalized because of all the other people who are dying from drug overdoses. I guarantee you 95% of them they don't have a medical reason but to even be on it. But I was told once that if you are taking your meds the way the doctor prescribed them, then you're not an addict. So yes, I take my meds exactly the way my doctor prescribed them, and some days I don't even need any. It's all these other people who are buying it off the street. You see, that's the difference. They're buying it off the street. They're not taking it according to the doctor's, recommendations. So a blood test will reveal all this. So if you can prove to the doctor that you're taking them as prescribed and your blood test, your liver, and everything is okay, then my God, we need help. I mean, we really do. So, bye.